We're going to talk about managing incontinence today. And more than 13 million people in the United States, male and female, young and old, experience the incontinence. Women experience incontinence twice as often as men. Thank you, pregnancy and childbirth. Menopause and structure of the urinary tract for females account in the differences. Of the 23.5 million women surveyed, 38% said that they suffered at least one episode of urinary incontinence at least last year. Among the women involved in the study, 13.7% of the women with bladder control problems said they suffered incontinence every day, while 10% said they have suffered it at least once a week. And women getting older, daily incontinence is more common. Women 60 to 64, 12% report daily incontinence, and it increases to 21% of age 85 and older. 21,590 men from nation's sample were surveyed. 9% of them reported a bladder control problem in the last 30 days. Among the men, 29% of the men with bladder control problems report stress urinary incontinence. And that's when you're coughing, laughing, running, you're losing urine accidentally on that part. 41% with them with bladder control problems reporting an urge for urinary incontinence, meaning you're needing to go very quickly, but you can't quite get where you need to go. 16% of the men with bladder control problems had mixed stress and urge incontinence. And 27% of the men with prostate conditions have the urinary incontinence. Causes. Incontinence is often a part of aging, but it's also for many other reasons. Some of the reasons are short: urinary tract infections, vaginal infections or irritation, constipation, and some medications. I was also reading that there are some foods that can irritate a bladder, them being alcohol, candy, caffeine, cantaloupe, which is very disappointing because it's delicious, carbonation, spicy food, chocolate, citrus fruits and juices, coffee, including decaffeinated coffee, cranberries, artificial sweeteners, which are really not good for you at all anyway, pizza, sugary foods, artificial colorings, pineapple, milk, and smoking. So those are all things that also can contribute if you have a lot of it in your diet as opposed to just that moderation. They will also potentially cause some aggravation, stimulation to your bladder to cause some incontinence. When incontinence continues for a longer period of time, it may be due to weak bladder muscles, overactive bladder muscles, damage to a nerve that controls the bladder from disease such as multiple sclerosis, stroke, and/or Parkinson's. The nice thing about the weak muscles, you can actually strengthen them. There are exercises and movement patterns that you can, both male and female, can increase their pelvic floor strength. Kegel exercise is probably one of the most common exercises where you're tightening. You can also just squeeze and release those muscles. You can put your index fingers and pull while you're squeezing, which facilitates activation of those muscles as well. Random pieces of information for you folks, sorry. When incontinence continues for a longer period of time, it may be due to individuals who had diabetes or nerve damage. So diabetes is one of those diseases that just can affect way more avenues than just the sugar levels. Blockage of an enlarged prostate, disease such as arthritis, Parkinson's, that may have result in people having difficulty getting to the restroom on time. So even though you might know you need to go, you just can't get there quite or make the transfer in time to manage your clothing and sit down in adequate time. They do make, just for FYI, they do make female urinals, so as well as male urinals, which I think are much more common. And having one, if you have that urgency, stress, and you have a harder time getting to the restroom, if you don't have a bedside commode next to your bed, you could actually, or your seating system, you could actually use a women's urinal. They work really great. They work even better when you're standing than sitting down, to be honest. The body stores urine in the bladder. During urination, the muscles in the bladder tighten. That moves the urine into a tube called the urethra. At the same time, the muscles around the urethra relax and let the urine pass out of the body. Sometimes that doesn't work as well, so the bladder doesn't empty all the way, or the urine comes back up into the bladder. Incontinence occurs if the muscles tighten or relax without warning. So that's when you're sneezing and you're laughing and those sometimes exercising when you're squatting, that you're not realizing your bladder is as full as it is, and one of those things cause you to have a little leakage. Stress incontinence, oh, see, squirrel moments, happen when urine leaks as pressure is put on the bladder, all those things we've just talked about, and it's common type of bladder control problems in younger and middle-aged women, especially after childbirth. It may also become more common around menopause. Urge incontinence happens when people have a sudden need to urinate but aren't able to hold it long enough to get it to the toilet in time. It is often, but not always, a problem for people who have diabetes, Alzheimer's, Parkinson's, multiple sclerosis, stroke, new hip surgeries, new knee surgeries, any of those things that slow you down from that ability to get to the toilet, which again, sometimes just moving that bedside commode in during those periods of time so that you're closer to it, or a urinal so that you can access the commode when you need to. Overflow incontinence happens when a small amount of urine leaks from the bladder that is always full. Diabetes, spinal cord injury can cause that incontinence because of the nerve damage. They don't have that sensation of being able to empty the bladder. They don't always have the sensation to be, or the muscle control to allow the urine to exit the body as easily. A man can have trouble emptying his bladder if the prostate is too large and is blocking the urethra, so it just doesn't allow the urine to flow as easily. Functional incontinence happens in many older people who have normal bladder control. They just have a problem getting to the toilet, right? So again, all the things we've talked about, any reason that might slow you down to get to the bathroom, even though you need to go and you're on your way. Urine retention is a lack of ability to urinate. It is a common complication of benign prostate cancer. Although it can be caused by nerve dysfunction, constipation, infection, or use of medications. One of the things I was reading earlier is that if you have issues with constipation and bladder, if you can get your bowels a little bit more under control, some of that urinary incontinence may change as well. So that the bowels are the first part to manage, and then the bladder. Urinary retention is characterized by poor urine stream, intermittent flow, straining to void, sense of incomplete voiding, and a hesitancy, a delay between trying and the actual flow. We all have this habit, especially women, I think, over the years of holding it for so long because we've got other things to take care of. So, don't do that. That's a message to myself as well. But, if you need it, because you really should urinate probably 6 to 8 times a day. I know that when people are on diuretics, they don't want to drink too much. Nobody wants to have to run to the bathroom or have those accidents, but it really is super important to stay hydrated, and it is important to go ahead and use the restroom as often as you need to. Urine retention can affect anyone at any age. However, it occurs most often in men who are in their 50s and 60s, and the incidence increases with age. Men of this age, in the 50s and 60s, often suffer from benign prostate hyperplasia or an enlargement of the prostate. The prostate surrounds the urethra and can obstruct the squeeze of the urine when it's enlarged, causing the retention, so that they can't just get the flow out easily when they need to go, or they don't empty their bladder. Therefore, when something happens and they're sneezing or they're leaking as well. Chronic urinary retention. You're generally able to urinate, but you may have a variety of difficulties such as stopping, dribbling, or frequent urination with little result, and you feel like your bladder has not quite emptied. In contrast, the acute one, retention is complete inability to urinate despite having a full bladder. Acute urinary retention is life-threatening, and you should find medical attention right away. The urinary retention, treatment of urinary retention depends on the type and severity, underlying causes of the conditions. You can minimize your symptoms and your risk complications by following the treatment plan offered by your healthcare professionals designed especially for you. And it may include a catheterization, so it ensures that your bladder is empty at all times after you've finished urinating, or to facilitate the whole urination. Dialization, widening the urethra structures, and discontinuing or replacing medications that may cause. So many of our medications have very long lists of side effects. So definitely, if you are prone to UTIs, if you're prone to bladder retention, and you're picking up new medicines, talk to your pharmacist, because despite the fact that the list is there, I'm not really good at reading all of them, but they're the ones who really know medications almost better than, better than your physicians. They know the interactions and they know the side effects. So if you are prone to that, I would suggest when you pick up your medicines to have that conversation with your pharmacist. Alternatives are also surgical repair of the bladder, positioning, or other pelvic problems. Treating the benign prostate hyperplasia, the hypertrophy, to reduce prostate enlargement, and treatment of urinary tract infections. When chronic urinary retention persists, or when it causes permanent nerve damage, most people safely can manage their condition with self-catheterizing. When you need to use that self-catheterizing, or have a spouse help you with that, you're gonna look for the fine motor coordination, the vision, maybe using a magnifier or a mirror so that you can make sure that you're seeing the regions in which you need to access. I think it's a little bit easier for men to do it than women. The vaginal area is just a little bit close, so a mirror can help. Your healthcare provider can teach you. The nurses are great about teaching how to self-catheterize. Today, there are more treatments for urinary incontinence than ever before. The choice of treatment depends on the type of bladder control problems you have, how serious, and how it fits your lifestyle. As a general rule, the simplest and fastest treatments should be tried first. So those would be weight loss, quit smoking, avoid alcohol, drink less caffeine, and then, as I mentioned, some of these other foods may also be something to take out of your diet for a little while and see if it also can impact. Lifestyle changes that may help with incontinence include preventing constipation by following a high-fiber diet, not lifting heavy objects that places or too much strain on the pelvic floor, and that you can buy special absorbent clothing so that when they're worn, they can just give you a little bit more peace of mind while you're out and about doing life. There are some herbs that you can try that are lavender, comfrey, plantain. More diuretics are the dandelion and the nettle root for teas that you can drink, which helps flush things out a little bit better for you as well. Besides bladder control training, you may want to talk to the doctor about other ways to manage the incontinence, medications. Some drugs can help the bladder empty more fully during urination. Other drugs might tighten the muscles so that you can lessen the leakage. There are also herbals for that, but I'm not quite sure what they are. I think cold foot is one of them. And then talk with your doctor about the benefits and side effects of using the medicines and in their relationship to both your medicines that you're taking as well as the longevity in which you may be on them. A doctor might inject a substance that thickens the area around the urethra to help it close around the bladder opening. This reduces stress incontinence in women. This treatment may also be repeated, and special devices for both men and women can help control, as well as those exercises. Look. Biofeedback uses a sensor to help you become more aware of your bodily functions. It may help you regain control over the muscles of your bladder and your urethra. Biofeedback can be helpful when learning those pelvic exercises, so it can allow you to know if the contraction is strong enough or if maybe you need to put a little bit more behind it or a little bit more quick movements till you can feel it. I find that any of those exercises with the pelvic floor, that if you can actually have a sensation, it helps you build a little bit quicker. But just doing it itself until you can feel it is equally beneficial for sure. The doctor may suggest bladder training. They're right here in Lancaster, over in Willow Street. Is it Dreyer? I think they have therapists there that are pelvic floor. It is, okay, thank you. Pelvic floor trained. Have to admit, on my list, never got there. The bladder training can change how your body stores and releases urine. There are several methods, including voiding diaries. So giving yourself a week to just keep track of how often you're going, maybe what time of day you're going, if there are what you've eaten during the day, so that you can see if there's any food or times that might be stimulating more urine or less urine or difficulty not getting there for whatever reason. And again, the time voiding, so that you get yourself to the bathroom every 2 or 3 hours, just to make sure that you have the opportunity to void if you need to. And the Kegel exercises, which is just squeezing into that urethra area and tightening it and then releasing it. So voiding diary, the therapist can help you organize and recognize patterns in incontinence and the task in which might be associated with these episodes. Defining factors may contribute to the incontinence. And keeping that diary, keeping that record really does give you that tangible to see what's going on, what you've eaten, what your day's been like, how much stress, was it a stress process, or whether you couldn't get there for whatever reason to the restroom. The pelvic muscle exercises work the muscles that you use to stop urinating. Making these muscles stronger, you can hold the urine in the bladder longer, which allows those folks who have a harder time getting to the bathroom. For me, it helps me get through my day, but for you, everybody, and myself, if we need to go, we should make a point of trying to get to the restroom when we need to urinate. Also, these exercises to improve your core can be helpful with addressing incontinence. And then E-stim, which is little pads that go on, and you can run that little current and then stimulate those muscles in the bladder and manage control. Have you tried it, the E-stim?
Not for the bladder.
Not, okay. Time voiding. In time voiding, you urinate on a set schedule. Every hour seems like a lot because then you have no life. So I would even suggest every 2 hours so you can get out and do something. If that doesn't work, then go to every hour. But I feel like every 2 hours is a reasonable time and allows you to have some quality. Therapy we can help you assist in developing a set of schedules to follow. You can slowly extend the time between bathroom trips, so going from 2 hours to 3 hours. And again, if you keep that diary, I feel like you have an idea of those general times in which your body goes more consistently, and those would be the times to make sure that you at least allow yourself to sit down. When time voiding is combined with the biofeedback, the pelvic exercises, you may find it easier to at least manage the urge to go and be able to get there in time. We can work on your balance as therapists. We can help you be able to get to the restroom more efficiently, safer, and we can offer equipment that we have talked about, the bedside commodes, the urinals. Therapy can also look at ways to modify just your environment. So sometimes the apartments living, we have things in our obstacles in our way, so we have to sidestep or we have to move around differently. So we can come in and help you set up your apartment a little bit differently. Sometimes function over fashion is important. If you suffer from incontinence, tell your doctor. Remember, under a doctor's care, incontinence can be treated. Even in the treatment not successful, be careful. Careful management, and you can help others feel more relaxed, and then we are here to help you. So dehydration, we've all talked about dehydration over time, right? It's important. We are made mostly of water, so it's not good to be dehydrated. You want to be able to, you want to drink. There's a a math equation, which I'm not sure what it is, but at least 32 ounces is good a day. So sometimes, get yourself a great big bottle of water and keep pouring from it just to see how much of that 32 ounces, 64 is better, but just see how much of that water. Coffee doesn't count, soda doesn't count, tea doesn't count. All of those have caffeine, so they are not hydrating. If you're not a big fan of water, add something fun to it. Add some orange, add some lemon, add some cucumber. Cucumber is a great diuretic also. And it helps the flavor of your water, so maybe you can do it. A lot of these we're talking about some of the things that we talked about earlier, this first page, different foods and beverages that could contribute to your incontinence. So if you find that you're doing something a lot, maybe remove it for a week, see if there's any changes, and then slowly bring it back into your life and decrease the intensity of coffee drinking, soda drinking, and add in water. The next page gives you a measuring chart. So if you're needing some type of support for depends, it will give you a way to measure out to see what size. I also find that whatever size pants you wear is pretty close to these. I know that they're a little tricky to get on. The dressing stick and the reacher can help pull out if you have a hard time getting it over your feet. It gives you a little bit extra pull to be able to put them on. I would say as far as the pads to start with, talk to your friends and find out what they find to be helpful and give them support both emotionally and benefits for your clothes. And this next page, there's a screening questionnaire, so you can ask yourself some questions and see whether or not it's time to speak to a doctor if you haven't, or maybe do the urinary voiding. You could do a bowel voiding too, and because again, one of the classes that I've taken online recently talked about if your bowels if you're constipated quite a bit, it's going to impact your urination. So one may not always be the other. So go ahead and look at your bowel routine as well and see whether or not that might be perhaps affecting your urination. And then the last one walks you through the Kegel exercises, which we've talked about. And then the very last one is that diary for you to look at times that you go, areas in which you eat things that might impact you. Licorice, for those of you, I know we're talking about urinary incontinence, but licorice can sometimes help the bowels. Again, if we have one, if the constipation is a problem, you might want to look at that and have those probiotics or another good ones to do that. So the exercises in addition to the Kegel, just real quick ones, again, holding your 2 index fingers in a hook and then squeezing, you'll get an extra pull, and or your last little finger, and you'll feel that that will help support that Kegel movement. Putting the ball in between your legs and squeezing while you're sitting down in the chair and allowing that exhale, let the ball squeeze, and being able to control your bowel or your bowels, your sphincters in that direction as well with the ball. And just the repetitiveness of squeezing, relaxing, the Kegels 20 times. I think what did it say? Hold on a second. 25 quick ones, and then holding it for 10 seconds, the contractions. So I took a MedBridge class, and it said the 25 quick ones in the morning, Kegels, 10-second holds, 10 times 10-second holds in the afternoon, and then 25 quick contractions in the evenings can also help you build up your strengthen the muscles. Not that I have any answers, but do you have any questions? Yes, ma'am.
I did go through pelvic floor physical therapy at Prayer.
Mm-hmm.
I went to the one in Strasbourg,
Okay.
and it was good.
I have coworkers that I've worked with who were going through the training, and they really do learn quite a bit about the whole pelvic floor and its interaction and the relationships. And so I feel like that if you go to someone who has that pelvic floor education, it really is beneficial. If these quick fixes don't work for you, find someone. And again, y'all are lucky because there's one, I guess, in Strasbourg, and I think there's one in Lancaster, but I think they have a satellite out here in Willow Street area. So they're close enough to you that you can find them, and it's not a terrible drive.
The amount of water you drink have anything to do with it?
So what happens is what I have heard from people that I've worked with, they avoid drinking because they don't want to have to go to the bathroom. But if you're dehydrated, you're causing a lot of other things going on in your systems. So what happens is when you drink your water and you stay at a homeostasis kind of water, you're not going to urinate more than 6 or 8 times a day, because it's that you purge yourself and then you don't drink enough, or because doctor says you've got to do it. So when you get to that homeostasis, it should not. If you're building yourself up to it, you may find yourself needing to go a little bit more frequently. And sometimes it's the food or the liquid in which you're drinking that causes it to flush out quicker. So will medication, if you're on Lasix or any form of that.
I've been on several prescriptions, and they always told my blood pressure to stop dropping. And the last time I was at the doctor, I said, is there anything new that I could try? She says, oh, just drink less water. My daughter said, what kind of a doctor is she?
Yeah, I'm a little right there with your daughter, and I probably shouldn't be out loud, but too late, there it is. I would say maybe stop drinking around 5 or 6 at night so that you're not going to be up all night using, because I do find that a lot of folks urinate more at night because everything just finally relaxes and allows. So if you stop around 5 or 6 o'clock at night, you will be less likely to wake yourself up as frequently, but try to spread it out a little bit. Do some of your medications cause you to urinate more, or they just cause the medicines they've given you? One of the things you can use that shouldn't, but you can speak to an herbalist or a doctor, nettle and dandelion. They're a nice diuretic. They're natural, so they'll help you and they should not, sorry, pulling up information in my filing cabinet back here. The nettle has a lot of electrolytes, so it's going to feed into your system. I will have to go back and double check on the dandelion and its interaction with the heart. But I think they're more adaptogens, so I think they go to where they're needed as opposed to, but something we should look up or talk to your doctor about for sure. But the flowers or the greens, you just make a tea out of them. The good news is you can, traditional medicines has a tea, tea bags, or you can get the loose herbs. But the young ones that you know that there's no chemicals on, you just put them in hot water and boil them down, and then you have a tea.
When you're on a medication too long, can it stop helping you? Because I was on one for a couple of years.
For urine?
I just went off of it not too long ago. But I'm on it, I don't think it's helping. But now that I'm not on it, I don't think it's helping.
Maybe it was doing its job. I think those are questions you really need to go to your physician or nurse practitioner, pharmacist. Those three people are pharmacist, nurse practitioner, physician. Sorry, guys. That would be a suggestion to go have the conversations. One, because they have more time to have the conversation, and two, the pharmacist, that's what they do. I worked in a place, and my doctors, be working with someone, and then 2 days later, I'd have this whole new person, and I'd run to my pharmacist and say, what did he do to her? And she'd go back and look and find out what medicines might have been added or taken away. She'd talk to the doctor, they'd get things, and I might have my person back again. So I always first recommend going to a pharmacist to talk about whether you could be on a specific medicine too long, or whether the interaction is, or so go speak with your pharmacist first.
Have you shared with anybody this new gizmo that if you're one that has to urinate quite often during the night, it's like a banana? When I had me operated on, and they got me ready for bed, I said, well, I have to go to the bathroom first. And then they handed that to me, and I was like, it works, and you can buy it.
They're not inexpensive, but yes, I've seen them in the hospital when my mom was in recently, and I considered buying one for her at one point because yes, it's just like a sponge that goes through the labia, and when you urinate, it pulls out and goes into a tube and then into a bag, kind of like the men's catheter, or the men's condom catheters that they can wear at nighttime. Which is nice because they slide on for men, and then they urinate at nighttime and there's no problem. Then the condom comes off and the catheter goes away. So they finally built something for women that works similar, yeah. They really are nice. But no, I've looked them up. I know you can buy them. I know they're a little pricey, but
They're advertised on TV.
oh, are they now? Pure Wicks? But yeah, they do work at night. Thank you so much for coming. If anybody out there in TV land has any questions, please feel free to stop by. The handouts will be also in the rehab gym if you need them. Thank you so much for having me. Meg will be back next month.